This program is called Quality Blue Primary Care. It's a way of engaging our primary care doctors throughout the state of Louisiana for better health for our members, and also it helps reduce the cost of health care by doing things like preventative care. Each physician gets a care management fee, and based upon their performance of how they control high blood pressure, diabetes, and things like vascular disease, that care management fee either goes up or down, depends on their performance. So we are actually paying for results instead of just paying for a visit.
It represents a new way in which we're rewarding physicians based upon how well they take care of their patients, not based upon necessarily all of the different things that they do, but rather how well they do it.
Well, try to imagine that your doctor is now working on commission. In other words, he gets paid more the better you get. So the healthier the population our doctors manage get, the more money he makes. We've aligned the incentives in such a way that the docs are completely focused on quality, on making sure that these patients get the best care possible for their chronic conditions. And it really is working very well.
Focusing on the Quality Blue program because we think that primary care is really the best foundation to help improve the health status of our members and the state. So it's a way to support primary care physicians taking care of their patients, to share best practices, and to recognize them when they improve the health of their patients.
We've actually seen a tremendous improvement. When we started this program in 2014, our initial results, we got a baseline. Today I'll be sharing with the group that we've almost doubled the number of members who are now in a better state of health than originally in 2014.
I think the physician response has been very positive. For a long time, physicians felt like they weren't necessarily being recognized for the quality of the care that they were delivering. We value our primary care physicians, and so this program focuses on primary care, and it rewards the physicians, and it does so financially based upon how well they manage the care of their patients.
Information. I think data is in itself a challenge. Too much of it is not good. Too little of it is not good, but using that information and measuring outcomes, so not measuring processes and if you're doing something exactly the same way for every patient, but more, have you been effective? Is that information readily available, one, to prevent chronic disease and to improve health? So I would say information. That has been our biggest challenge, and I think, as we're entering year 4, that is what we contribute our success to.
The most important thing that our stakeholders, the group leaders and employers need to know is that we have well-documented evidence that shows that the more of their members see the docs involved in this program, the lower their hospital costs are. In fact, we can point to a study that ran over 2 years that shows clearly that patients inside of QBPC, for example, were $28 a month less expensive to insure than people outside of the program. That's a real return on investment that's measurable and has been documented by a third party, namely Tulane School of Public Health.
In 2013, we designed and launched QBPC. That took a lot of hours. I know we came to our physician advisory committee with a proposal. I still say they hated it. We listened, we went back, we redesigned it, and I think because we listened to you guys, it came out to be a much better program because of that. Once we designed it and kind of got going, it really was about growth. We were talking to your practices, we were trying to get people enrolled, and we were growing the program. Remember last year we had Tulane come and validate that we had proven success, not only with better care, but lower cost. And then this year we're looking for breakthrough improvement, so you'll see some more improvement that we have made. So QBPC today, where does it stand? We have 728 primary care docs. We have almost 220,000 of our Blue Cross members attributed. About 85,000 of those, have one of those 4 chronic diseases, and we paid about $16 million to date in care management fees, on top of the fee-for-service payments. this just shows that year over year, we continue to grow. We're still out there, getting practices into this program. Membership, the same way, still growing. The program is still on a growth pattern. Just to remind you, what did Tulane say last year? Well, they looked at those members who you guys are seeing, and they said, you're doing a great job. You're doing such a great job that they're actually getting more preventative services than patients that are seeing non-QBPC providers. They have fewer hospitalizations, and there's a lower cost of $27 on average per patient per month on that, and that was Dr. Shi. We have submitted that for publication. He submitted that for publication, and to my knowledge, it's not quite out there yet, but it will be hopefully published in the Journal of Managed Care. Here goes the graphic that went with that. There's more tests, lower costs, more primary care visits, and fewer hospital stays. We actually got some national attention right after that. So the Patient Centered Primary Care Collaborative recognized the great work that we have done together here in Louisiana and gave us all some national recognition. So many of my colleagues are out there talking to a lot of employer groups, and the employer's like, yeah, I kind of heard those Tulane results last year, but I guess I'm still asking, are you still seeing that? And while this was not quite as sophisticated as Tulane did, the basic results are the PMPM cost went up at a slower pace with a QBPC provider than with a control group of members seeing a PCP, but they're not in QBPC yet. So it's a lower trend. The admits to hospitals, there's a decreasing trend with QBPC and a slight uptick with the control. So it's about 1.5% difference in that. ER visits, slower uptick in ER visit rates. Now you really know what I'm worried about. Somebody asked me, what are you worried about? I said pharmaceuticals, and pharmaceuticals. And so the trend for prescriptions, as bad as it is, 20%, I wish I had that on my 401k as a trend at 19%, almost 20%. The control group even had higher at about 25%. So I would say we get a check pretty much all the way down that we are still seeing great results from the work that we are doing. I wanted to go back and just say, where do we start? Really one of the first good measures was really done in 2014. And what you're seeing here is the actual percentage of patients there we go, skip the slide. Percentage of patients who in 2014 had, for diabetes, all four things controlled. Their blood pressure, their A1C, lipids addressed, and not smoking. That was 14%. Hypertension was controlled, 52%. And 52% is about national average. That is about where you hear it reported throughout the whole country. So we were probably right at national average. Vascular disease, 15%, and kidney disease, 45%. Today, we've almost doubled each of those over a couple of years. Diabetes is almost twice as many patients, now at 33%. Hypertension went up to almost 70%. Vascular disease, 36%, and kidney disease, 71%. And when you do that across 85,000 patients, there's a lot of heart attacks, strokes, and other negative outcomes that really are being affected very nicely with those results. We continue to support, we're still very much invested in this strategy of investing in primary care. So those of you who've been in the program for a while know that initially it was just Louisiana Blue Cross patients, and then we're able to recently expand that to if you had a Blue Cross member from Texas who actually maybe lived in Louisiana or had a kid going to school at a local university, that you could actually start attributing those members into your practices by some of the work that we've been doing with our association to sort of do that back office work to make sure that those attribution dollars flowed. We continue to promote the primary care visits. What we're doing in 17 is continuing the lower QBPC office copays, but we actually raised up the ER copays because we really do want to incentivize people to see patients, those patients to see their primary care doctor and not just go shopping in each ER. We also are, you saw with the pharmacy trend, we're addressing smarter pharmacy benefits. So there have been, those of you who, read the newspaper about some of these things that companies are doing. I'm just going to give you one example of some of the things that this is going to address. So there is a product that addresses, the toenail fungus, and the active ingredients literally is $35 when you buy it by itself, but they sell it as a kit for 10 times that price. And so we're not covering the kit. We'll still cover the active ingredient. There's some other sort of scams that we're trying to address. This is just, we're doing it to where the spending with pharmaceuticals is smarter, and we still are trying to deliver the care for the patients in the proper way. Building on success, some of you are in our Quality Blue Value Partnership, where you start looking at the total cost of care. It's a shared savings program, and we hope more practices are able to join in that initiative as time goes on. We initially had 5, and we're now at 11, and that program is going well. So one thing I wanted to address is people are asking us, well, where are you guys going? And we had a really good conversation this morning, and someone asked a very nice question that I'll use here is, well, of the people that are seeing a primary care doc, how many are in your QBPC program today? And the short answer is about half. So we have about half of our members who have chronic conditions that are seeing a primary care. We have about half of those actually in this QBPC program. To address the other half, we are building probably a secondary program that's sort of a claims-based program that can actually go to those that don't have an EMR or have a difficult to work with EMR. We are still, for QBPC, the way it stands today, and you're hooked up and you're happy, there's no changes coming in 17 that I know about. And we're going to continue that, while we try to continue to expand engagement of this other half. And if it is where it is, and I honestly just don't have any particular changes in mind for that. 2018, next year, we may talk about a few measures, but it'll still basically be generally the same program that you're dealing with today. I want to talk just a little bit about breakthrough improvement. So, that's really, our focus is hypertension. Well, why hypertension? Hypertension is so pervasive. What really hit me last year was just how many people are really affected by this disorder. And, it's a pretty simple measure. It's the most simple measure. There's a blood pressure. It's not, blood pressure plus something else. So it's kind of easier to focus on. It lends itself to getting your protocols going, your systems and your processes going, trying to get people to come back for those checks. As a matter of fact, it's so pervasive, it's in 3 of these suites. I actually, I'm a bit of a math head, so I actually did this correlation analysis and basically said, if you don't get hypertension under control, there's no way you're going to get top tiering in this particular program. It drives 80% of your overall score. So the correlation was 80% between hypertension and the overall score in the program. So here's what we're doing today to focus on this particular illness. We're going to be learning. And so we're going to be learning both from our keynote speaker, and we're going to be learning from the panel. And so one is from a population health and what happened in JNC 8 and hopefully where some of these things are going to be headed, and be well informed with hypertension, sharing best practices. And then remember last year we said, hey, instead of just recognizing the top 10% of docs for hypertension, we're going to set a target, and anyone above that level will be recognized. And so I'm very happy to say that we have 163 docs who hit the 70% mark this year. All right, so before the panel discussion, I would like to introduce Dan Lackland.
What I'd like to talk about today is some of the issues looking at population risk of elevated blood pressure. Why should you care? Why should this be a top priority for you as we identify it? I think it is. I congratulate you on doing that, and I congratulate you for achieving these goals, but I also want to try to help you and show you that you are doing something. We are making it a better world in that case. Talk a little bit about the evidence and the impact of things like target blood pressures, where we want to go, and what is the evidence for picking that up in here, and what were some of the discrepancies between different guidelines and different opinions. And then again, talk about, again, those target blood pressures. But I'd like to kind of begin where, and I'm going to relate this to the southeastern portion of the United States. Some of you know this. This is Churchill, Roosevelt, Stalin at the Yalta Convention right before the end of World War II. And one of the issues right in here, where does blood pressure make a difference in your life and my life? At the Yalta Convention, Roosevelt's having some really hard times. And you know, they were deciding how are we going to divide up Europe after World War II, and particularly Germany. Roosevelt would nod off his blood pressure, and we're going to talk about that. His blood pressure was so high he'd nod off and periodically. Stalin knew it, and so Stalin released his plan whenever Roosevelt went to sleep, with the idea that Roosevelt was so vain he wouldn't admit he had dozed off. He wouldn't admit that, and so you see how indeed Europe was divided and not so fair. Well, a little bit after this photo, Roosevelt died, had a stroke, and here was the headlines. It came out of, we didn't know he was doing really great. He was hopping around and, you know, going on trips and everything else, doing pretty good. Dropped dead, and they said, we don't understand. He had a hemorrhage, and we don't understand what happened. But maybe that wasn't so clear. Maybe those headlines really weren't evidence-based headlines. Here's where his blood pressure was right at that convention. So you think about your patient. You've got a blood pressure with a systolic between 200 and 250 going on there. I don't think you're thinking your patient's going to be doing very, very well. So we lead into that and lead into the emphasis. This is some data. It's called the Enigma of the Southeast, 1950. You've just had your president to die, and what Roosevelt said before he died was, whenever I go to Warm Springs, Georgia, I always feel better. He went down there, and he said, it's something in the water. So the U.S. Geology Society in 1950 went door to door looking for water sources and looking for a healthy water source with regards to the lower risk that you would see of stroke. They didn't find that. What they found was in this case in the Virginia, North Carolina line carrying through these contiguous counties through southeastern Georgia, they caused some of the highest stroke rates in the entire world. Probably with Roosevelt, what he failed to tell people was in Warm Springs, Georgia, he had a girlfriend, and that was probably what was better for him out in here. But it wasn't anything in the water, but that's what we thought. So now what happens? So let's look at let's look at decades later. What have we done? We've known this to be the case. Now, this is why I wanted to show this so emphasized here. You in Louisiana can take pride with us in South Carolina as having some of the highest stroke mortality rates in the entire country. This embodiment that we do see in the southeastern portion of the United States. That's what we've achieved, and probably it's not anything in the water. One of the things that we did, a little study we did a few years ago, we were asking the question as to why. And what prompted us to do this study is I have a colleague in New York City, and he said, if we break down where people are born, he said, our problem in New York is these people from South Carolina coming up here and having their strokes and dying, and that's our problem. If we get rid of the South Carolina people, we're doing okay. Well, that hurt my feelings a little bit, so we did this little study and asked this question, and you can too, and there's going to be reasons for us going through this. Where were you born? My mother gave me birth in South Carolina, and that's where it is, and I'm proud to say that's the case, except my mother didn't fail to tell me, now you have an increased risk of having a stroke and dropping dead. Those of you that were born in Louisiana and you're born in the Southeast, you're no better than I am. You've got the same risk, and we're just going to watch each other and see who has the stroke quickest. These are extremely significant levels, folks. These are really bad. This is like me having an additional LDL cholesterol that's really high. There's a big thing just simply being born here. Where it really shakes out, we did this kind of work. This is what stops you. Boy, this really knocks into here. This is looking at stroke mortality if you weren't born in the Southeast. So looking there, if you're Caucasian, you've got about a 25% lower risk simply not being born in the southeastern portion of the United States. Look at African Americans, 50% less risk of having a stroke and dying. Just simply don't be born here. So what's the intervention? I was telling Paul this here. Here's the intervention. So let's round up all our pregnant women, put them on an airplane, and let them go somewhere else and have their babies. Clearly, that's not going to happen. And I don't think it works really good with the plans. And so we need to think, here we are, what do we do with this tremendously high risk stroke that bring it through? This is a little bit of other work that we did too, and this is looking at stroke incidence. And so I can tell you quickly, it's not the neurologist here in Louisiana, and it's not the neurologist in South Carolina. They're doing a great job. Our case fatality rates are just as good. In fact, they're even better in the Southeast. Maybe we have more practice, but we're still better at it. We can keep people alive. We're having more strokes. And this is some data. The first column is South Carolina. This is Rochester, Minnesota. This is a cohort out of Mayo Clinic, and the other one is Connecticut, out of New Haven, Connecticut, with Yale. We have more strokes in the Southeast. You already know that. I didn't need to come here to tell you that you knew it. But what we do have, we have strokes at earlier ages. About 10 years earlier onset, we see of the strokes in the southeastern portion of the United States. More strokes, earlier ages, bringing in that additional risk that we tend to have. Also kind of looking in here is now we're going to implicate hypertension, where I think it is, and I know that you do as well. If we look at population attributable risk, this is data from our 1960 Charleston Heart Study and Evans County, Georgia Heart Studies, bringing it together, looking at these population attributable risk. For white men, nearly 1 out of every 4 deaths that are occurring because of elevated blood pressure. For African American men, 45%, nearly 50% of these individuals, their death was related to the elevated blood pressure. Speaking a little epidemiology, if you'll allow me just for a moment, what that would say is if we had either controlled the blood pressure or we had prevented the high blood pressure from occurring, we could have prevented nearly 45% of the deaths from occurring. If you do that all the way through and you do achieve these wonderful blood pressure goal rates that we've been discussing right up in here, you're almost removing the racial disparity that we have in stroke and cardiovascular disease. I think it's a great opportunity for us. I'm very passionate, and I know you are too. This is the direction for us to go. Our message here today is that hypertension, high blood pressure, is a major factor that we have both in the southeastern portion of the United States as well as globally. And it's important, that's the bad news, and certainly increases our risk of stroke and heart failure. But more importantly, it's something that we can do something about. So we know that we can reduce our risk in this population by controlling blood pressure and actually preventing high blood pressure.
I am so happy because we sent out a challenge at the collaborative last year to really focus on hypertension. Hypertension is a disease that is the most common of chronic conditions. It affects so many people in Louisiana. And we sent out a challenge that if they got a certain percentage of their population controlled, that they would be recognized. And today we're going to recognize 163 of our physicians that have actually achieved that goal. To kick off the award presentation, Blue Cross has a new CEO, Dr. Steve Overhigh. And Dr. Steve is a primary care doc, and he's going to say a few words to kick this session off. Dr. Steve.
Thanks, Paul. So it's actually great to see a room full, or partially a room full and half a hallway full of primary care practices. As Paul said, my clinical training was as a primary care general internist. So professionally, I've always believed that primary care was really the foundation on which to take care of patients. And it's great to see that we've got, about 150 practices from around the state that have come together to share not only best practices, but it's an interesting evolution for me. When I went into primary care, I won't tell you when that was, many years ago, candidly, primary care was not well recognized, probably a little bit undervalued. I think there's been ebbs and flows. I would say today I'm very bullish on primary care. I think it is beginning to get the recognition that it has deserved. Healthcare is so complex, and it's increasingly complex, that I think for people who don't have well-established relationships with a primary care physician, it's going to become increasingly hard to navigate this system in a productive way. So the Quality Blue program, which was actually one of the first things I learned about when I came to Blue Cross, or I should say learned about it in detail, because I actually knew about it even before I came here, because it has gotten well-deserved national recognition. I think it is a great way to recognize and reward primary care physicians who are doing a great job of taking care of patients, as I said, in an increasingly complex environment. So I will just tell you from my standpoint, it's something we've been committed to. It's something we're going to stay committed to. It's not a static program. We'd like to see it evolve and improve. So we certainly welcome your feedback as to how it can be made better over time, and again, in the interests of delivering better care. And it's great that we're going to be able to recognize somebody this afternoon for some of the outstanding work that you've done. So I just want to say it's nice to see some other primary care faces in a city and state that is well populated with specialists. And my appreciation to all of you for what you do for our members and your patients. So thank you very much.
All right, Selena is going to be in charge of the awards.
It's my favorite day of the year, professionally speaking, and this is the best part of the program, in my opinion, again. We were challenged last year at the end of the last collaborative by Dr. Murphy to focus on hypertension. As you saw in his opening presentation, 163 of our QBPC physicians met or exceeded that goal of achieving 70% or higher in the well-controlled category for our chronic disease state of hypertension. So with that said, as Dr. Jeffries said earlier, it's a team. We have a team approach, And with QBPC, there is no possible way that you all and we together collectively could have achieved such an astounding number. But we met and exceeded that. So what I'm going to do is I'm going to call for help, and I'm going to ask that some of our quality navigators that are an important part of the team in achieving this come up and help me with this presentation.
All right, so for the Baton Rouge region, the first clinic that we wanted to recognize for hypertension control, top performers, that's everyone that was over 70%, is the Baton Rouge Clinic. And for the physicians that are here, if you will stand and stay standing at your table until we finish the slide and we can recognize you. Dr. Frank Alvarez, Dr. Christina Austin, Dr. Harold Brandt, Dr. Richard Cooley, Dr. Jewel Crockett, Dr. Jennifer Greason, Dr. Rachel Gruner, Dr. Jeffrey Kahn, Dr. Adrian Landry, Dr. Joseph Lariviere, Dr. Rebecca Trull, Dr. Vincent Tuminello, Dr. Edmund Vinci, Dr. Eric Wagasback, Dr. J. David West, and from our Baton Rouge General Physician Group, from Baton Rouge Family Medical Center, Dr. Brad Gaspard, Dr. Stephen McCullough, Dr. Lauren Moore, Dr. Kenyatta Shamlin, Dr. Tasha Shamlin, Dr. Robert Wood, Dr. Michael Yorick, from Bella Family Medical, Dr. Timothy Bella, from the Baton Rouge General Physicians Group, Dr. Andrea Brown, Dr. April McCullough, Dr. Philip Paget, Dr. Gunjan Reyna, Dr. Akela Robinson, Dr. Desi Valentine, Dr. Henry Young, from the Family Health Center, Dr. Vincent Shaw, from Medical Associates of Baton Rouge, Dr. Tanisha Mixon, from Oak Grove Family Practice, Dr. Vincent Nguyen, from Primary Care Group, Dr. Vasanthi Vinayagam and Dr. Darakshan Wahid, from Westside Family Medicine, Dr. Brian Higgins. Y'all give them a round of applause, please. Okay, up next, we have our Ochsner top performers, and this is Ochsner statewide in hypertension. Dr. Talalik Alvarez, Dr. Mirza Baig. Oh, and who's our quality navigators for Ochsner? Come on up, please. Dr. William Baird, Dr. Walter Birdsall Jr., Dr. Pedro Casabon, Dr. Janet Cook, Dr. Troy Davis, Dr. Nicholas DeSalvo, Dr. Cherie Duke Wheeler, Dr. Andre Duplantis, Dr. William Ellerby, Dr. Nona Epstein, Dr. Sarah Fernandez, Dr. Adelaide Francois, Dr. Christopher Garnett, Dr. Patricia Gendusa, Dr. Dwight Green, Dr. Christopher Guarisco, Dr. Megan Hartman, Dr. Jackson Hatfield, Dr. Jack Heidenreich, Dr. Brian Helmstetter, Dr. Keith Holmes, Dr. Ted Hudspeth, Dr. Brandy Jones, Dr. Gloria Leary, Dr. Timothy Lindsay, Dr. Michael Marcello, Dr. Laura McCormick, Dr. Laura Nikosha, Dr. Joellen Plunkett Kasparek, Dr. Christina Ravendran, Dr. Lisa Richards, Dr. Rochelle Shiro, Dr. Victoria Smith, Dr. Robert Tassan, Dr. Robert Taylor, and Dr. John Wise. Y'all please give them some applause. All right. And next, we have the St. Tammany Quality Network. Their top performers for hypertension were Dr. Charles Baer, Dr. Lebo Berthelot, Dr. Christopher Foray, Dr. Mark James, Dr. Linda Kiefer, Dr. Glenn Kessler, Dr. Natalie Masherpa Kirkow, Dr. Jennifer Miles, and Dr. Ralph Miet Jr.
At this point, I'd like to invite Audrey Cuvillon to join me on stage.
Good afternoon. It is my pleasure to announce the top performers in hypertension for Gulf South Quality Network. I'd like to ask the quality navigators that work with GSQN on a weekly basis and do a great job to join me. When I announce your name, please stand and remain standing until I'm finished, and then we'll hold our applause until I'm done. The top performers for GSQN Tulane are Dr. Jan Cooper, Dr. Timothy Harlan, Dr. Terry Cummings. For GSQN East Jefferson, Dr. Lindsay Ford, Dr. Michael Euling, Dr. Robert McCord, Dr. Robert Pollock. For GSQN Toro, Dr. Jennifer Birch, Dr. Avita Curry, Dr. Maureen Hecker Rodriguez, Dr. Christopher Leger, Dr. Meredith Maxwell, Dr. Robert Achapinte. And for the GSQN West Jefferson chapter, Dr. Patricia Jackson, Dr. James Tice, Dr. Alan Bowers, Dr. Bertha Daniels, Dr. Evelyn Maxino Bakuda, Dr. Joshua Mizell, Dr. William Newman, and Dr. Cherie Drez Bragg. Please join me in congratulating them.
Now, Christine Castile will help us. She will award the Southwest and the Central Louisiana top performers in hypertension.
Hi, I'm the Care Transformation Consultant for Southwest and Central Louisiana, and we'll start there. The Quality Navigators for that region. Awesome. We'll start off with CINLA Family Medicine Associates, Dr. William McBride and Dr. Michael Scripidis. Could you please stand? And we'll hold applause just the same. Family Medicine of New Iberia, Dr. Jose Mata. Imperial Medical Clinic, Dr. Jason Morris, Dr. Brian Wilder. Lafayette Internal Medicine Clinic, Dr. Bradley Dowden. Landry and Lechtenberg, Dr. Ryan Foray. GSQN SWLA, Dr. Jody George. GSQN Lafayette, Dr. Rick Modis. I'm the Care Transformation Consultant for Health Leaders Network, and we'll start with their top performers. We'll first make sure all of the Quality Navigators are up here. All righty. Got everybody? Dr. Paul Aguiloy, Dr. Gerald Barber, Dr. Michael Baudin, Dr. Donald Brignac, Dr. Matthew Chamberlain, Dr. Charles Halliburton, Dr. Ronald Hubbard, Dr. Bradley Meek, Dr. Louis Montellero, Dr. Darshan Patel, and Dr. Derwent Walker.
For our final region, North Louisiana, Courtney St. Germain will join me on stage.
Good afternoon. I'm happy to announce the North Louisiana top performers for hypertension. Would the Quality Navigators for North Louisiana please come forward? And when I call your name, if you'll please stand and hold applause until the end. From Affinity, Dr. Stuart Melton and Dr. William Smith. From Bossier Family Medicine, Dr. Michael Angelo, Dr. Patrick Deere, Dr. Anthony Flowers, Dr. William Moranto, Dr. Robert Soche, Dr. Joseph Tynes. From the Family Doctors, Dr. Wayne Barksdale, Dr. Marion Cash, Dr. Ross Hammock, Dr. Ellie Hudnall, Dr. Ricky Jones, Dr. Katie Kerr, Dr. Ann Landry, Dr. Timothy Mathis, Dr. Sharon Mercer, Dr. Kevin Murphy, Dr. Charles Patton, Dr. Teresa Renderly. From Green Clinic, Dr. Terry Gardner, Dr. Edward Mariano, Dr. Sheila Mariano, Dr. Martina Tamaclo. From Highland Clinic, Dr. Roan Flanagan. Shreveport Internal Medicine, Dr. Mark Brown, Dr. Craig Miller, and Dr. Eric Smith. Willis Knighton, Dr. Pierre Blanchard, Dr. Randy Del Mundo, Dr. Deanna Donley, Dr. Larry Flake, Dr. Eddie Johnson, Dr. Diana Lim, Dr. Kennedy Lim, Dr. Jason Milligan, Dr. Bipin Turakia, and Dr. Clint Wilson.
That concludes our top performers for hypertension. What a great job. Can we give one more round of applause to our 163 physicians? I'm going to share with you the names of our top performers in chronic kidney care. And I think I was remiss in pointing out that, of course, as the physicians checked in today, we have already provided the certificates to them. So they've already received those. That's why we asked, just for ease of flow throughout the room, that they stand and we give you recognition. So please, if I call your name and you're still here this afternoon, please rise so that we can share in this excitement. Our top performers for chronic kidney care are Dr. Christine Austin, Dr. Gerald Butler, Dr. Allison Barbin, Dr. Timothy Bella, Dr. Brad Gaspar, Dr. Rachel Gruner, Dr. Scott Harrington, Dr. Adrian Landry, Dr. Christopher Leger, Dr. T. Richard Liu, Dr. James May, Dr. Timothy Riedel, Dr. Joseph Tynes, and Dr. Clint Wilson. Now I'd like to share with you our top performers in the diabetes chronic disease. Dr. Wayne Barksdale, Dr. Pierre Blanchard, Dr. Cherie Drez Bragg, Dr. Marion Cash, Dr. Bertha Daniels, Dr. Bradley Dowden, Dr. Anthony Flowers, Dr. Ryan Foray, Dr. Brad Gaspar, Dr. Ross Hammock, Dr. Brian Higgins, Dr. Patricia Jackson, Dr. Brandy Jones, Dr. Ricky Jones, Dr. Katie Kerr, Dr. Ann Landry, Dr. Joseph Larivier, Dr. William Maranto, Dr. Meredith Maxwell, Dr. April McCullough, Dr. Bradley Meek, Dr. Jason Milligan, Dr. Joshua Mizell, Dr. Lauren Moore, Dr. Kevin Murphy, Dr. Lillian Nelson, Dr. Vincent Wynn, Dr. Charles Patton, Dr. Robert Pollock, Dr. Teresa Renderly, Dr. Robert Saucier, Dr. Rochelle Shiro, Dr. Kenyatta Shamlin, Dr. Tasha Shamlin, Dr. Victoria Smith, Dr. Rebecca Truhl, Dr. Bipin Tudiakia, Dr. Robert Wood, and Dr. Michael Yorick. Now, this is going to be the presentation for the highest achieving clinics. So these awards, I'm sorry. Oh, I skipped vascular. My goodness, I apologize. Please forgive me. Let me read these. I would like to share with you our top performing physicians in vascular care. Dr. David Abdahu, Dr. Christine Austin, Dr. Leo Blaze, Dr. Jean Calais Jr., Dr. Daniela Cardoza, Dr. Marion Cash. Okay, sorry about that. Dr. Wartel Castile, Dr. Bradley Dowden, Dr. Cody Fontenot, Dr. Christopher Foray, Dr. Brad Gaspard, Dr. Ross Hammock, Dr. Richard Haney, Dr. Mark James, Dr. Rebecca Jones, Dr. Ricky Jones, Dr. Adrian Landry, Dr. Brian Lindemeyer, Dr. Jason Milligan, Dr. Kevin Murphy, Dr. Vincent Wynn, Dr. Gunya Reyna, Dr. Robert Saucier, Dr. Tasha Shamlin, Dr. Catherine Strother, Dr. Rebecca Trull, Dr. Bipin Tudakia, Dr. Joseph Tynes, Dr. Clint Wilson, and Dr. Michael Yorick. Thanks again for that catch. See, it does take a full team. So we are now going to shift to the part of the program where we recognized our highest performing clinics. Let's see. Okay, so I see on here our highest achievement criteria is on the screen. And I think at this point in our 4th year as we enter that you guys are familiar with the process. So without further ado, I'm going to share with you, let's see which clinic here. All right, a little teaser. Let's see if you can guess which clinic this is. This clinic we're awarding highest achievement in diabetes care. So I want to give you, a little tidbit. I know that we've had our panel up here, and maybe or maybe not, they were on stage already, but I want to share with you some tidbits of what a high-performing clinic sounds like in providing an achievement-worthy award for diabetes care. This clinic they've been live since October of 2013. They have about 7,400 lives. They have over 300 logins to the MD Insight system. What's unique about that is that over 200 of those logins are by the physicians themselves. They're a little unique in that in terms of utilization of the system. With that said, I'd like to call, without further ado, the family doctors in Shreveport. Our next clinic, I'm going to award the highest achievement in hypertension care. I'll do the same thing, see if you can figure out which clinic this is. This clinic, they have been live since 2013, so they've been on board with us since the program inception. They have 6 PCPs. They care for about 3,600 of our attributed lives. They have a dedicated population health staff, and they have an education center on site. The award for highest achieving in hypertension care goes to Bossier Family Medicine. Congratulations. Don't go too far, guys. Don't go too far. Keep standing. Come on back. Come back. I'm inviting them back because they also have been awarded the highest achievement in vascular care. So I'm going to quote what you heard earlier because I was so excited I had to write it down and fit this in. But when Dr. Moranto was on stage, if you remember, he said, "Protocols is where it's at." There you go. Okay, our next award for highest achievement in chronic kidney care. Give you a little teaser about this clinic as well. This is a second-generation clinic. They have 2 PCPs. They have about 1,000 lives in their practice. Let me be clear, Blue Cross lives in their practice. And they've been live since October of 2013. They're part of the Baton Rouge General Physicians Group. So the highest achievement in chronic kidney care goes to Bella Family Medical. Congratulations. So at this point, Dr. Murphy is going to join me.
Better get my glasses on. Okay, this is for the overall high performance award where we take all the suites and all the things that are in QBPC. Look at that, and I think next slide. A little bit of a delay. All right. Okay, so you have to have, the overall highest score. You got to do it for multiple months, and it includes the efficiency measures as well. So, top site overall. For the first time, there is
a tie.
A tie. Yeah, I went back and checked it many times. It's like, is that to the decimal point? Those of you who know me know I'm really particular about decimal points. So, yeah, so to the decimal point. So we're going to do this with ladies first.
Well, thank you. We'd like to invite up the family doctors.
And Shreveport Internal Medicine. All right, how about another round of applause?
He challenged us last year for hypertension and to achieve 70% or greater. Well, we're going to close today with another challenge, and that is to boost colorectal cancer screening. We have partnered with the Louisiana Colorectal Cancer Roundtable. Dr. Rob Mascalis, who's with us this afternoon in the back of the room, actually serves on the roundtable. And he and the roundtable and a couple others that are collaborating really decided to let's join forces and work. Let's share information. Let's try to improve colorectal cancer screening rates in Louisiana. They have a very aggressive target. They want to achieve 80% by 2018. At our next annual collaborative next year, we will be handing out awards and showing recognition for all physicians that achieve 80% or greater. We have lots of information. If on your way out, if you'll stop by our booth, we'd be happy to share that information with you. And as you know, we're a committed partner to help, ensuring that we are sharing information and participating on this colorectal roundtable so that we can achieve 80% by 2018.
There's a lot of great things about Louisiana. One of the things that's not so great is the health status of the state. We rank 50th now in the nation. And a lot of that is due to the prevalence of chronic diseases. And the best way to take care of chronic diseases is through an established relationship with a primary care physician who focuses on keeping you well all the time. So what Quality Blue does is help physicians identify and close gaps in care and improve the management of those chronic conditions so that people stay well. And if we do that across the state, then the entire state will get better.
I can tell you this, if there's one way to motivate physicians, it's to challenge them and to compare them amongst their peers. So today's a great opportunity for us to highlight how well the program has worked, but also it gives us a chance to recognize and honor those physicians who are among the best in the state with regard to how well they manage their patients.
The awards are a great opportunity for us to do shared learning among all the docs because these programs are relatively new. And so some of them have gotten a little bit ahead on figuring out how to make this work. And when they get awarded, the rest of them can see what's going on and they have an opportunity to learn what the techniques are. They're very collaborative here and they love to share information with each other and they're a little competitive too.
This is the best day of the year for us when we get to celebrate success. So the tie shocked us. We checked and verified our numbers, but it's really exciting to know that the size of a practice, the number of PCPs, everyone can be winners in this program. So it's really nice to be able to share.
For years we tried to put a program like this in place and the general narrative was docs will never put up with this. What turned out to be the case are these doctors went into medicine because they care about making people well. And it brings out all their best features to know that they'll be rewarded for making their patients' lives better. And so it aligns beautifully with the reason they got into medicine in the first place. And once they figure that out, they are very enthusiastic about it.
We're proud that in the state of Louisiana, we've developed a program in collaboration with primary care physicians that not only helps them do a better job, but has been recognized nationally as one of the best collaborations between a health insurer and physicians, and really a model that we can build on.
If people have questions like more information about the program, what should they do?
They can certainly visit our website. They can call our customer service. We have many ways. We have a special website at www.bcbsla.com/QBPC that has a lot of information on it.